And so it's very, very important when we think about building a sustainability program that financial piece is critical, because we want to make sure that we're balancing this with all of the other competing needs of the organization. And we're not just running off, reducing electricity use or, making our ORs efficient, but then also resulting in a financial or health impact, right, to patient care.
Without supplies, there's no surgery. Without products, there's no patient care. Welcome to Power Supply, the healthcare supply chain podcast focused on helping you navigate the intricacies of logistics, purchasing, contracting, and supplier relationships. Each episode, we speak with healthcare executives, supply chain leaders, and innovative entrepreneurs from across the country as they share their stories, experience, and expertise on the industry we love. From the loading dock to strategic sourcing, from buyers to the C-suite and across the enterprise, we tackle the real-life issues impacting the healthcare supply chain. Whether you're tuning in for conversation or inspiration, we're glad you're here. You're just in time to hear it from the source and stock up on insight. So sit back and plug into Power Supply.
On this episode of Power Supply, we will speak with Chris Sanchez, Sustainability Project Manager at Baptist Health South Florida. And Hayes, good friend of ours, recommended Chris because he's in his organization there. Folks may remember us speaking with George Godfrey on the podcast. I believe it was last year. And anyway, told George I was looking for great guests, and he said, hey, have you had anybody on to talk about sustainability? And we have, in fact. We've had a couple of solid sustainability conversations, but it's been a little while. And the truth is, there's just not a lot of them out there, and it's an ever-changing environment. Did not mean that as a pun, but it's an ever-changing environment. We're always looking for new opportunities. And so I love having experts like Chris on the show, as we will have him today.
Chris is great. He brings good energy, but he really knows what he's doing. And he's been in other places other than healthcare. So I think he's going to bring a playbook that you want to listen to. So stick around. You'll enjoy it.
All right, everybody. We're going to be right back with Chris Sanchez after a short break.
Bam!
I'm Hayes Walder.
This is Gary Skinner.
And I'm Justin Poulin.
From the studios of Healthcare HQ, you're listening to Power Supply.
Joining us now is Chris Sanchez, Sustainability Project Manager at Baptist Health South Florida, where obviously you might have suspected we're going to talk about sustainability, but we're going to talk a lot about core metrics and communication as well. And, if your organization does have somebody in a sustainability role, it's usually them, or maybe them and one other person if you're lucky enough to have somebody in your organization that's supporting supply chain from the sustainability perspective. And so we've had a couple of these conversations over the years, but because there aren't a lot of you, Chris, we don't get to have a lot of the conversations. And when I find a new fresh voice, we want to bring them on. You happen to work at an organization with a past guest that did a wonderful job on the show, in George Godfrey. And so he connected us, and I wanted to welcome you to the Power Supply podcast. Thanks for coming on.
Thanks, Justin. Wonderful to be here. Very happy. I'll make sure to try and follow in George's big footsteps. But we'll have a good conversation today. I'm excited about it.
So, Chris, why don't we just talk about your background in sustainability? Because you and I had a chance to talk ahead of time, and I realized that your background isn't in supply chain; it's in sustainability, and you're bringing that to the supply chain in Baptist Health South Florida as an organization.
Yeah, thanks, Justin. Great question. And it's been a really, unique and empowering experience to be a sustainability professional in a leading supply chain department at Baptist. Sustainability is, what is sustainability? I guess is one of the biggest questions that everybody asks still to this day. And I think it's going to continue to change over time. My background and how I got to sustainability is, I really started my interest doing a combined bachelor's, double BA in environmental science and anthropology. And, for me, that was sort of the nexus, the starting point where a lot of our questions about how the environment works, how people relate to it, and how our decisions as individuals, as organizations, as nations, right, all have these outcomes, these impacts on the way that the environment functions. So that's kind of the starting point for me. And then as I've gone through my career, I've kind of transitioned over time from, field science, right? My first couple jobs were out taking measurements in wetlands and going out to the Everglades and all kinds of stuff like that. And as I progressed more into sort of strategy development, policy development, my interest has really become not just in project management, but in looking, big picture at how organizations make decisions and how those decisions ultimately have some kind of an environmental impact, whether it's positive or negative, right? And a lot of what I've tried to bring to my role right now is to understand how to take those methodologies and really use them to define a sustainability program. And then measure, our impact and progress as we go along. So it's really coming from a heavily, science-based, science communication sort of background, right? And figuring out how we look at the way companies and organizations work and try to maximize our environmental benefit.
That's fantastic, Chris. So like when you got there to Baptist, which I think is a rather innovative health system for sure, but when you got there, was there a playbook in front of you or did you have to create all this from scratch? Kind of give us a feel for that.
Yeah, a little bit of both. I do want to give due credit to, my predecessors here at the company. Baptist has been very engaged in sustainability for a long time, decades. We actually built one of the first LEED certified hospitals in the state of Florida, which was our West Kendall Baptist location. And that was back in 2011, I believe. So we've been at it for a long time. But my role was really, and me stepping into the role was really the first time that the organization wanted to dedicate an FTE, a resource specifically to sustainability, right? Prior to this, a lot of it was handled by folks that were very passionate about it, but they may have worked in academics, they may have worked in nursing, different leaders at different hospitals over the time. So really what this represented was a consolidation of all of that knowledge and experience that we had gained over the last 10 to 20 years into a dedicated role that could focus on how we formally measure and manage a sustainability program as a large, 12 hospital health system and not even talking about all of our outpatient centers as well. So, it's been an interesting journey that there really, despite there being some groundwork, there wasn't a formal playbook in place. And that was a lot of the conversation that I had with George, with Matt, our CFO, was really to stepping into this role, understanding that was something we were going to build together. And it's been a really amazing journey and a lot of learning for myself and many of the folks that I work with on how we really make a functional and effective sustainability program in this health system.
Hey, Chris, you answered Hayes' question on the playbook. Was it, implementation? Here it is. It's right in front of you. But as you take that role, with all of the pieces that you talked about, you're really looking at a defined, your creativity, your analytical brain can just see it working as you're talking. You describe yourself as an internal consultant to this position. Maybe talk to the listeners a little bit about what that means coming into that and then how you strategize.
Yeah, great question. So, I've always, in all of my roles, seen myself as kind of an internal consultant. And I think as a sustainability professional, to Justin's point, there's typically in any given organization or company or government, right, there's not typically a lot of sustainability professionals, right? There may be one, there may be a small team. And so really, we kind of act as change agents within an organization, inserting ourselves sometimes into existing roles and sometimes into brand new roles that, previously have not existed. And really look around and assess, right? What are the big gaps here? Is it data? Is it processes? Is it technology? And try to understand where the most, effective starting point would be for really getting that low-hanging fruit and making as much progress as you can on sustainability. So, when we look at how that played out at Baptist and working as kind of an internal consultant, our position was created within supply chain. But, since my second day on the job, I've been working, hand in hand with folks from all across the company, from non-clinical and clinical departments, facilities, accounts payable, you name it. And as an internal consultant, my role is really to, starting the role, doing really a listening tour, right? Talking to different folks, understanding what are the challenges, where are the gaps, where are the opportunities, and then working very carefully and very closely with all of these different departments to figure out what programs make the most sense, and where we can really get traction on reducing, ultimately, our goal is to reduce greenhouse gas emissions and waste, right? So it's really about assessing with kind of fresh eyes, right? What's working and what's not, and then figuring out what are the teams that we need to bring together to collaboratively, right, develop solutions to some of these issues.
So brand new position to the organization, right?
Yep.
You're kind of defining what the terms of success look like at that point. Like, I'm sure you got some guidance from leadership of, this is why we created this position. This is what we would like to see from it. But at the end of the day, you're the one that's going to probably decide how you measure yourself, because you're going to have to make a case for this position is valuable and you got what you were asking for in these measurable ways when you decided to create this position in the organization. Was that a little daunting for you to try to figure out how to decide how you're going to measure yourself? And are you doing it fairly? And even better yet, maybe like, are these the kinds of metrics that are going to tell the story that the leadership wants to see?
Yeah, no, that's a great point, Justin. And I try to be, I picked fair metrics, right? We picked things that could be measured objectively. But, my biggest saying, is that you can't manage what you don't measure, right? And so if we're talking about managing our sustainability, managing our environmental impact as an organization, that was a big part of the early conversation with this role, is what are those core metrics that we really need to look at? I have, ideas about that as a sustainability professional, things I've done in other roles, what are kind of typically done in the industry. But then there's also the specifics of what, a healthcare supply chain department wants to look at. I would say, the biggest guiding principle that we established very early on is that our core metric that we really want and need to be measuring and reporting on is greenhouse gas emissions, right? And I guess, for the listeners, if you're maybe not super familiar with that terminology, right, greenhouse gas emissions are all of the gases, primarily carbon dioxide. And in many cases, there's many other gases that are produced by any of the activity that's happening, at a typical company or organization. Those are sometimes organized into different categories, which are called scope 1, scope 2, and scope 3. I'm happy to talk a little bit more about what that means. But, essentially all of the things that we do as an organization, the electricity we use, the natural gas we burn, the anesthesia that we procure and use, the waste reduce, all of these things are individual metrics that you can measure. But at the end of the day, all of it really boils down to what is that greenhouse gas emissions factor that your company is producing? And then from a strategy standpoint, how can we identify what the biggest sources are and then develop some tools, technologies, and processes to try and address them?
Let me just jump in here and ask a quick question, kind of like a maybe give me a fifth grade answer, because that's what I need on this right here. Do you look at your role and this initiative as something that is it a cost center? Can you actually do good and save money, or does it cost money to do good things? And kind of give me a feel for that.
Yeah, that is the literal $1 million question, right? Yeah, I love that, Hayes. Thank you. So I think that's a really good point, right? And when we think about sustainability, again, it's a very open term. People have a lot of different definitions for it. I typically try to look at the definition, which takes into account what we call the triple bottom line, right? So there's three things in sustainability that we want to achieve, three different, kinds of sustainability. One is obviously the one that everybody knows about, the environmental piece, right? We want to make sure that what we're doing as an organization is environmentally sound. It's not, causing undue impact locally or globally, right? In terms of the waste or emissions that we produce. The other two are equally as important. So the second one, Taze, to your point, is financial sustainability, right? You can't just go all in on protecting the environment at the expense of your business. And especially in a case where we're producing or providing a critical resource, which is healthcare, right? People are going to be sick. People need care, and they need the best care that they can get, right? And that has to come first and foremost before we consider things, right, like the environment. And then the other piece that's really, really important, the third piece of sustainability is people, right, or health. And so when we think about, the financial and environmental piece, the other missing link that people sometimes don't think about is that close connection between sustainability and health, right? So we know that all of the impacts that are produced in the environment by society ultimately have health outcomes, right? There's many different ways you can measure that. And we see in the news all the time different elements, such as asthma rates going up, right? That can be, very closely linked to environmental, right, impact. And so it's very, very important when we think about building a sustainability program that financial piece is critical, because we want to make sure that we're balancing this with all of the other competing needs of the organization. And we're not just running off, reducing electricity use or, making our ORs efficient, but then also resulting in a financial or health impact, right, to patient care.
Chris, was there, I think just being the initial startup of this, getting this going, and like clarity is discovered through the journey, right? Mm-hmm. Was there an aha moment of an example you can share with us for our listeners that you're like, oh my gosh, as we strategically plan this, one of those buckets that Hayes asked about, is there a example you could share with us and our listeners that kind of describes that aha moment maybe?
Yeah, I think energy is a great topic to focus on for that aha moment. So, again, if we start with the concept that, we want to measure our greenhouse gas emissions, typically in most organizations, especially in healthcare, energy, right, is going to be one of the biggest sources of environmental impact, of financial impact, right? And also ultimately when we think about the emissions that energy produces, right, the health impacts as well. So it's to me, it's a perfect encapsulation of that triple bottom line. And we actually did, as part of my first year in the role, one of my big goals was for us to do a greenhouse gas emissions assessment and determine, of all of the things we do as a company, right, where are we seeing the biggest environmental impacts? And energy, as soon as we did the assessment, stood out. I think it was like 70% of our scope 1 and 2 emissions was directly from natural gas and electricity use. And so we knew, and this is, very common. You'll see this at a lot of different health systems. But we knew right away that was going to jump out as one of the most important pieces. And energy is a great topic because it's a win-win, right? As we reduce our kilowatt hours used or our therms of natural gas used, not only are we directly reducing the amount of emissions that we're producing either, on site or through our utility companies, but then we're also immediately reducing our costs, right? It goes hand in hand. And so that's been a big success, very important collaboration with our finance department, with our facilities departments to really rally around this concept of on-site energy use and look at all of the different ways that we can try and tackle that, both from the demand side, right? So looking at how much energy we need to use and trying to lower that. But then also on the production side, we've been looking a lot more into renewable options to be able to actually produce our own energy at some of our facilities. And again, both of those have great, financial stories to go with them as well, which is how it's been such a great success.
Thank you, Chris.
Yeah. Great question.
I think aligning multiple stakeholders is so key. And one of the things that you were talking about at the very beginning was being an internal consultant, but really defining that as a change agent. So you're not necessarily a decision maker. You're like a really heavy influencer if you're really good at what you're doing. And one of the ways that you can influence is making sure that you're kind of hitting on priorities from departments that may not have the same priorities, which is why I think those three sort of like touch everybody in some way. But I wanted to go back to the health piece because I wonder how much, obviously when you're engaging the clinicians, in the OR or any other clinician within the walls of the hospital, when you start focusing on health and they're thinking the immediate impact on the patient that's right there, that resonates. I'm just sort of curious on this one, just because I am a nurse and I know some of the psychology, how watered down does that message get when you're not talking about the patient they're taking care of that day, but you're talking about the health of the surrounding community and the impact that you're having maybe on the community in terms of energy consumption or some of the other areas that apply to sustainability? Does it mean a little bit less when you're not talking about the patient that maybe is like right on the table?
Yeah, I think that's a great question, Justin. And I think sometimes drawing that, this is one of the core challenges of sustainability, right? It's a topic or it's a profession where we're thinking big picture and we're thinking long term, right? We're thinking about health in decades, right? As opposed to what a patient may be presenting with in the ER or in a primary care facility in a given day. I think you'd be surprised that there's actually kind of an intuitiveness, right? As our providers are seeing patients every day, each one of those patients is obviously a case unto itself, and each has its unique facts and circumstances. But these are all data points, right? And I think in speaking with clinicians who see thousands of patients a year, maybe more, it really depends on what your specialty is, but we've started to see a lot of kind of intuitive understanding that some health issues, I mentioned asthma earlier, especially childhood asthma, are becoming more common. And there's a lot of, I'm not a clinician, I'm not a health professional. There's certainly many different contributors to some of these dynamics. But I think that there's a growing clinical understanding that some of these chronic environmental stressors, heat, air pollution, flooding, and water quality are slowly but surely over time becoming a more prominent driver of some of the community health outcomes that we're starting to see. So in all of my conversations with clinicians, there's actually a pretty good understanding of the link there. It's not direct, right? That's the hard part. These are all things that are happening at a much bigger scale than a given, an individual or a patient. But when you look at the community health trends, especially down here in Miami-Dade County and Broward County, we start to see some of those things pop up as significant drivers.
Well, yeah. I'm walking into another follow-up because I really understand the psychology of a nurse. I did this, especially early in my career when I was many, many years ago in my 20s when I still thought I was invincible. Another thing that often happens with caregivers is they deprioritize their own health because they almost feel like, well, if I'm taking care of other people, I'm not going to get sick, right? Like, because I'm giving, and it's not something that necessarily comes out super obvious, but the reason I'm walking into this is I wonder, have you gotten at all into like some of the surgical smoke conversation? Because surgical smoke isn't necessarily going to have a large environmental impact, in its aggregate, potentially. I'm saying that just as an assumption, not that I've looked at the data on it, but I'm assuming some of the surgical smoke, like it's contained, it's evacuated. It's probably not a large source of pollution, but it is a significant, potentially, as at least all the research seems to point to it, and AORN has really driven at it, is it does seem to be a significant source of environmental pollution in the operating room. And yet there's only been a handful of states that I think that have passed any legislation around evacuation. And so, I think maybe it's people aren't as concerned about it because, there's one patient in the room, but there's probably 10 caregivers. I wonder, does that even come across your table in that way? Or is that kind of like outside the purview of your role in an organization?
No, it does. And actually in two different ways, I'll touch on that, Justin. So, the first is you mentioned operating rooms, right? And when we think about sustainability in healthcare, there's different statistics out there, but one of the ones I see commonly quoted is that ORs alone, right, in their aggregate and all of the supporting infrastructure can represent up to 30% of the energy use for a hospital system. It also is, I forget the exact number, but it's a very high percentage of the waste production. So ORs are these really intensive spaces from an energy, from a waste, from a resource and chemical standpoint. And that does have its impacts. I'm not personally familiar with surgical smoke, but another really good example that's similar is actually anesthetic gases. So a lot of hospitals already, today, in our system and across the country have what are called waste anesthetic gas scavengers, right? So similar to surgical smoke, as anesthetic gas is inhaled and exhaled by the patient, that excess gas is actually collected by these devices and exhausted so that it's not, inhaled by physicians. But, if a hospital system doesn't have that system installed, if it's not calibrated correctly, right, that is a possible avenue for clinicians to be exposed to additional gases that they maybe normally wouldn't be, that could be considered, potentially health issues. Now, I don't think this is happening on a dramatic scale. I don't think this is something that's like dramatically impacting provider health. But Justin, I think you make a great point that, as we also move towards sustainability goals, like reducing chemicals of concern from our supply chains, using, gases that are less impactful in the ORs, we're also achieving, to some extent, these outcomes for clinical, for clinician or provider health, or occupational health that are very beneficial. So it's not just again, it's not just about the environment, right? But some of these choices we might make about sourcing more responsibly or stocking our ORs more responsibly from an environmental standpoint also have a net benefit for clinician health as well, which is obviously very important.
That's a good example. And Chris, I always have this, mythical character named Tommy in Tulsa, or Tommy in Tupelo, either one.
It's Rusty in Tupelo. I thought it could be
Rusty. I know, but my point is, there's some guys and gals out there who are under-resourced, right, overworked, but really enjoy what you're saying, right? They're like, boy, I wish I could do something here, but I don't have a full-time person. I don't have this capabilities. But is there something that maybe one tangible or two tangible things that you've actually done or you've implemented that would be actually helpful for Tommy? Could it be just be reprocessing, or what could it be? Can you have an example or two that might be helpful?
Yeah, I mean, I started a little bit with the anesthesia example, but I mean, that's a wonderful example, in my opinion, right? Where we very clearly are hitting that triple bottom line. So, anesthetic gases are very environmentally impactful. To give you an example, desflurane, which is one of the common anesthetic gases that's out there, each unit of desflurane is 2,500 times more impactful to the atmosphere than a single unit of carbon dioxide, which is the gas that, typically when we hear about climate change and sustainability, right, a lot of people focus on CO2, but each molecule of this anesthetic agent is tremendously more impactful on the environment. And when you look at an organization's greenhouse gas emissions, anesthesia can actually end up being a very substantial part of that because of the fact that these gases per unit are very, very environmentally impactful. So, a lot of anesthetic use is driven by two things, right? One is procurement, and one is, clinician preference or clinician practices. And this has actually been a big success for our organization and with, kind of relatively little friction, has been able to get our clinicians, get our anesthesia leaders together and talk about and do some education about why these gases are environmentally impactful, how we can transition away, specifically from desflurane and start to look at some other anesthetic agents as our primary agents for certain cases. And then work very closely with our pharmacy administration group to actually reduce the procurement and the contractual obligations related to gas purchasing. And altogether, those two factors actually ended up allowing us to move significantly towards reducing the use of desflurane in our system. So I would say that, Hayes, to your question, a lot of these issues, a lot of these kind of low-hanging fruit for sustainability wins are sometimes just a matter of reaching across the aisle and doing some education, engagement, and getting folks talking to each other to realize there may be a lot of progress we can make just through adjusting, right, certain clinical practices, adjusting certain procurement contracts, right, to be able to make it easier for us to not buy a lot of this stuff that's very environmentally impactful. So that's one area I would definitely recommend as a starting point, is to look, generally at your ORs, but specifically at anesthesia purchasing to see what you may be able to do to, very easily reduce your impact. And I say easily, not to discredit all the hard work that went into this, but relative to other things, it's really a matter of getting the right folks in the room and having those conversations to understand that it's really a matter of just kind of putting better practices, better policies, better procedures in place.
We talked about how the fact that there's usually, if you're lucky, there's one of you in an organization or a small team. So at the end of the day, you're kind of isolated a little bit. Like, what I love about bringing folks like yourself onto the podcast is we get that message, broadened out there, and that you make yourself a resource to maybe some of those organizations that don't have somebody to at least get pointed in the right direction, right? Because here you are talking about, hey, here's where some of the low hanging fruit is. So maybe you don't have somebody who leads sustainability for your organization, but your organization has made it something that's important, and you're trying to look for where you can have an impact immediately. This gives people a lot of great ideas, but I'm sort of curious just how important networking is for someone in your role for that reason. You're not necessarily going to have a sustainability mentor that's at your organization that's bringing you up along. So you've got to look outside to kind of grow professionally in your niche, don't you?
Yeah, I would definitely agree with that, Justin. My background before coming to Baptist was I actually worked for Miami-Dade County and local government here in South Florida, and it was really interesting in that particular position to see how many resources and how many networks exist for local governments to connect and collaborate and share knowledge about sustainability and climate planning. And coming into the healthcare space, I feel as though, some of those networks aren't as well developed at this time, but there are a couple of important ones throughout the country that are really helping to connect sustainability professionals locally and then also, regionally and nationally. One of the common ones you may hear a lot about is Practice Green Health. That's a wonderful organization that has a great national reach that connects sustainability professionals in health systems with all kinds of resources. But there's also what I've seen is more sort of ad hoc kind of local, networking and collaboration that tends to happen. There's not a high number of health systems, right, in any given, municipality or county or region. There's typically a handful, right, of large health systems. And, what I find is that those professionals tend to kind of know of each other and reach out and connect. That may happen organically, right, just through, I might go and find out Google the sustainability role at my neighboring health institution. But there's also, local conferences, local meetings that may not necessarily be about healthcare that end up connecting some of us. And so one way or another, professionals tend to find each other.
How do they find you? Tell them how they find you.
You can find me, I guess the easiest way would be you can visit our company website, baptisthealth.net. We've got a great sustainability page on there with all kinds of information on the programs that we run. You're also welcome, to reach out directly to me. I'm happy to share my email. Justin, I don't know if you want to have it on the podcast.
Yeah, go right ahead.
Yeah, you can reach out to me. My email is christopher.sanchez01@baptisthealth.net. Happy to chat. I think, a big part of success and sustainability is that peer learning, peer knowledge sharing. So it's very important that as we learn things, right, we continue to share that information. Justin, to your point, there's typically only one, maybe a handful of us at each, institution. And there's only so much we can tackle at a given time. So while we Baptist may be making strides in a couple of areas. Certainly, there's other health systems that have priorities and others that have advanced, and we can learn from that. We're happy to share our knowledge about what we've learned, from our experiences on the projects that we've chosen to prioritize right now.
Also, Chris, I'll be sure to give everybody your personal mobile number too. Make sure. Is that cool?
Street address, social.
And he lives. Can we put your home mailing address on there?
Yeah, let's just pull up Google Maps right now.
No, actually, I think people will want to reach out because to my point, I use Tommy. There's a lot of people they just don't have a resource. They don't probably know where to go, frankly. So I think it's fantastic.
All right, Chris, give everybody a vision for what's next for you, and then we'll wrap up.
Thanks, Justin. So now that we've established our playbook and we've identified what our core metrics are for sustainability that we want to track as an organization, our goals are to try and address the biggest opportunities for sustainability that the story of our data is telling us. So primarily our focus is really on energy use, fleet, and anesthesia. So on the energy side, we're looking pretty aggressively into new technologies like building automation that will help us intelligently adjust energy to actually meet the demand that we're seeing at our sites and the utilization patterns that we see at our sites. On the fleet side, we're working to convert many of our electric vehicles that meet certain usage criteria to either electric or plug-in hybrid to try and make those more efficient. And then for anesthesia, we're actually formalizing some new guidelines to reduce the use of certain gases that are more impactful to the environment based on the tremendous success that we've seen with a pilot program that we launched last year. So overall, that's really where we see the biggest opportunities to address greenhouse gas emissions and improve sustainability in the near term. And finally, I'm also excited to share that I'll be moving into a new role, which is the Director of Sustainability and Resilience, where I'll be looking into how to enhance sustainability practices and reporting in our supply chain, and also take some of the initial lessons learned that we've gotten from our first few years in putting this playbook together to really standardize them across the system and really drive impact across the entire Baptist portfolio.
Awesome, Chris. Great job. Keep up the good work.
Yeah, thank you guys. I appreciate it.
That was Chris Sanchez, Sustainability Project Manager at Baptist Health South Florida, talking about sustainability, core metrics, communication, and honestly, Gary, he's an excellent communicator, but when you have one representative acting as a change agent in your organization, it really helps when you have the polish that Chris has, because I can just see how he's effective. When you get one person to do a job, they got to be the right person. And the fact that he's definitely the right person and is so willing to share like his, the way that he's been successful, how he's been able to develop that program. I mean, honestly, even though he's in a large organization, he's really an entrepreneur at heart.
100%. I mean, I will give Hayes asked the best question today. Was there a playbook? No. He came in and implemented from step one and connected the dots. He talked about all the right people, facilities, clinical, supply chain, pulling everybody in to make it work and defining the metrics to support what the strategic direction was. So just learned a lot. I feel like the listeners will learn a lot today on what this looks like on sustainability, which is a very widely used term. But he defined it in a different scope and got even in the deep in the anesthesia gases. So just a great episode, great communicator. Chris was money on the spot. Great podcast. So appreciated having him on.
Yeah. On behalf of Gary Hayes and myself, thanks for listening to this episode of Power Supply.
Bam!
Thank you for listening to this week's episode of Power Supply. As a reminder, you can help support us by subscribing on your favorite podcast app or by downloading the smartphone app on your iPhone or Android. Simply search for Power Supply in the App Store or Google Play. The best thing about downloading the smartphone app is that you can access bonus content for certain episodes and view episodes in certain categories, like articles on the go and vendor spotlights. Are you following us on LinkedIn or Facebook yet? If you are and you love an episode or post, then let your social network know about it. Like, comment, or share our posts along with your thoughts and keep the conversation going. If you have any topics or guests that you would like to recommend for a future episode, just send us an email to info@powersupplymedia.net. We look forward to hearing from you.